Hello and welcome to the Somatic Movement and Mindset podcast with me, clinical somatic educator and founder of Total Somatics, Heidi Hadley. The Somatic Movement and Mindset podcast has been designed to help you gain a deeper understanding to how your mind and body work. You will learn about your amazing mind and body and why over time you can feel pain, recurring injuries and poor posture. Within this podcast, I will teach you why this doesn't have to be your future or the norm for you. Would you like to learn how to reduce pain, move freely, and gain a new lease of life? Let's get started.
Hello and welcome back. Now, in today's episode, we're going to consider the connection between neck pain and dysfunctional breathing. Now, the reason that I mentioned these two together is they're two very common questions that I'm asked quite often, actually. And the first question that people will ask is, how can I ease neck pain? And then the other question that I get is, how can I release tension in and around my rib cage to help with my breathing? So these are really powerful questions. And what they really require us to do is to stand back with soft eyes and look globally at our soma. Consider it generally, not just looking at where the pain points are, where the symptoms are. Again, that's the old-fashioned way. And as we know with neuroscience, neuropsychology, psychoneuroimmunology, all the different things to do with movement science and pain science, we know that it's more than just dealing with the symptom, because the symptom will just keep coming back. Why? Because there's a root cause or there's a reason behind it. And that's what we're going to look at today. Is the reason is that these old strategies, there are strategies that people have been going and seeing practitioners for a long time. These include things such as dry needling or trigger pointing areas in their neck or their shoulders to release the neck pain. And granted, in many cases, it can take away the pain, but quite quickly it will return. Likewise, people might be given neck stretches as home care, or they may have assisted types of neck stretch techniques given to them by a health practitioner. Again, when we know that your brain is patterning muscle tension and tightness, no matter of external force is going to change the sensors in your muscles that are being told by your brain to hold the belly of that muscle tight. So what happens is when people start doing stretches of their neck, or there's assisted stretching with a practitioner, the practitioner doesn't know where the end range is of that movement because they can't sense and feel from within. That has to come from that person individually. So what will often happen is people will get cramping, spasming their neck. Sometimes as well, it might just take out the alignment slightly in their neck or in the shoulder in different places. Because when the muscle is tight and the belly of the muscle is tight because the brain is telling it to stay tight, that will not shift with no amount of stretching you do. So what happens is either side of that belly of the muscle into the joint, that starts to be pulled and stretched. And we get things like tendonitis, you can get tears happening. That sort of thing is because if the brain is holding on for dear life to the belly of that muscle and saying, do not let go, stretching is not going to resolve the issue. And that's why we know pandiculation really is a very powerful technique to use as opposed to stretching, because pandiculation changes the tension and tone of the belly of your muscle at a brain level. And when we change it at the brain level, we make huge changes to the movement and the memory of your muscle. So let's consider neck stretches or assisted neck stretches, trigger pointing, dry needling. And even points such as if someone's saying they've got issues with their breathing, people might say things like lie on a foam roller or do some pec or chest stretches to open out your chest. Well, that again is really useful. It's really nice. However, again, it's a band-aid issue. The reason it's a band-aid issue is because underneath all of this, your brain is patterning the tension. Again, no amount of that superficial stretching is going to really change anything, because as soon as you get off that foam roller, you go back to your habits, you go back to whatever you were doing before, boom. The brain recalibrates to that level of tension and tightness that you have. And unless you pandiculate, you won't be recalibrating to a new open, lengthened, new normal. You've basically gone back to the old habits that you'd already been creating over time. So again, what is it that people are forgetting? They're forgetting that your brain patterns tension. So that is why when we just consider the symptoms, when we just go for a quick fix, it really is just a band-aid. We aren't getting to the root cause. And so that is why, in actual fact, neck pain and dysfunctional breathing are very heavily influenced. And that is because they have something that's in common. And that is that your brain is changing tension subconsciously throughout the day, through habits, through stress patterns, through different things that are happening. And it's only when you're aware of this through things such as total somatic education that you can start to actually shift and change and create a new level of normal within your muscles, within your fascia. You start to sense and feel how you should be standing, the correct weight through both feet, how you sit or how you twist and you move, whatever you do. All of this comes into play when we look at total somatic education within the Total Somatics membership, because it is, again, standing back, looking globally, having soft eyes, and realizing from head to toe, we've got fascial pathways that connect from, say, the arch of your foot all the way through the back of your body. They loop over your head and it finishes at the top of your eyebrows. So when you see things such as the horizontal lines on someone's forehead, that level of contraction, that is still heavily influenced by a pattern of contraction all the way through their back, their lower back, their glutes, their hamstrings, right down to the plantar fascia, which is into the arch of their foot. So you've got patterning of tension. Whatever's going on in the foot is going to influence through the middle of the back. It's going to influence through the neck, all the way across to your facial muscles. So can you see how complex, how incredibly amazing we are, and how we need to kind of embrace this, the research and the science of today, not from like 10 years ago when we talked about stretching and just, again, fixing one area. Remember, your brain patterns tension, full body patterns of contraction throughout your body. So if your brain patterns these areas, then what we need to do is methodically work through that brain patterning and start to create changes and shifts in your muscles so that you start to get that softening and you get that movement back. And consider what happens if we soften your muscles, if we get muscle memory back. It's going to take pressure off your joints. It's going to increase shock absorbency. So you're going to get that bounce and that rhythm back into your body. It's going to improve your spine and your overall postural health. The pain will be reduced. That metabolically and energetically, you're going to feel less exhausted because you've got muscles that don't need to be constantly contracted. Imagine if you're walking around, for instance, all day, flexing your biceps or gritting your teeth or clenching your fist. That's exhausting, isn't it, if you did that all day? It's exhausting for your body. It's exhausting and tiring for your joints and your tendons and everything else in between. And yet that's what we're doing in different areas of our body. We're holding this tension all the time. And so imagine how wonderful it would be just to let that unnecessary tension just release and let go. Imagine how much more energy you would have. Imagine how much more freedom you'd have in your movements. And all that is possible to achieve, because when you know how to change the tension and the tightness of your muscles at the brain level with pandiculation, it changes everything. It really does change. And what happens is that you start seeing opportunities that you can enjoy the activities that you've always loved to do, but you've had to reduce it because of the pain and the restriction of movement, postural changes, joint issues, that sort of thing. And so that's why just consider pain is really like a bit of a wake-up call or an alarm bell for us to say, hang on, we need to change this. Because if you continue down this route, then we know that it's just going to get worse. You're going to feel more pain. Whereas if we use pain as actually a friend to remind us that we can actually have that little bit of a wake-up call to think, now what are we going to do to reset, change, and create movement, rhythm, momentum, shock absorbency, bring everything back into our body so we can have a better quality of life. I'm sure you'd agree with me that when we are educated and empowered in skills and techniques that are going to help our well-being, we are going to just bloom and blossom, because that's what I've seen over the years with my practice. So we can start today, because you have this process of bioplasticity and neuroplasticity. So the neuroplasticity is where your brain is constantly adapting and changing, molding and shaping. Likewise, your body is doing that bioplasticity. So we can mold and shape and basically create a whole new way of moving, whole way of sit, how we breathe. We can take a lot of tension from our neck and rib cage away by creating specific techniques with pandiculation. So if you're not in the Total Somatics membership, but you'd like to join, please go to the Join Now page at totalsomatics.com. If the membership doors are currently closed, please leave your details in the wait list. And when we open the doors to the membership, you will be the very first to find out about it. In the meantime, you can get started today. If you go to totalsomatics.com, click on the shop page, and then you'll see there's lots of different classes to consider. However, I'd like to suggest just a few to you in relation to what we were looking at today as regards dysfunctional breathing and neck pain. So if you go to totalsomatics.com, click on the shop page, scroll down, and you'll see there's 3 audio classes that are really popular in the area of neck pain and breathing. And the first one is the rib release sequence. So that's rib release sequence. The next one is the hip and shoulder release. And then the third one is improve your posture. They're all really popular. They're really, really popular. But in particular, because of this episode today, check those out. So it's rib release, it's hip and shoulder release, and it's improve your posture. So there's 3 that you could get started with today. Start to feel the changes, how things happen quite quickly too. But also, in the meantime, just to find out a little bit more about this powerful work, this power of pandiculation, how you change the tension and tone in your muscles from a brain level with pandiculation, please check out my free PDF download. So if you go to totalsomatics.com, click on the home page, scroll down just a little bit, and you'll see a yellow flashing sentence that says free download FAQ guidebook. And in there, I've actually created the answers to some burning questions that I get asked quite often. And also there's lots of links to specific episodes of podcasts that you might want to check out that support some of the questions that were asked and some of the ways that I've answered them too. So there's plenty of resources for you to get started with already. So until next time, all my love and best wishes to you all. Take care. See you soon. Bye.
Thank you for joining me today. If you've enjoyed this episode, please leave a rating and also forward this on to somebody you know will benefit. To learn more about pain relief, plus how to improve your health and well-being, go to totalsomatics.com. Until next time, take care.